Hi, my name is Nicola Fox from Refoxology, and today I'm going to talk to you about the essential oil, which is tea tree. And my focus on the techniques and using tea tree today is going to be for the ears. If you or maybe your child suffer with earache, then tea tree can be fab for this. My daughter suffers with earache, and I've got this in a roller ball, and we apply it to the back behind her ears, kind of the sides of her nose, on her throat, and on the chest area. And I do that in the morning and in an evening, and it's really helped just to reduce the amount of times that she gets earache, and it is great, and she loves it. So today I'm going to talk about the reflexes which link to the ears and kind of clearing out that maybe infection that they get. So we're going to look at the ears, which is at the kind of bottom of the finger where it joins with the hand on the little and the next finger. We're going to look at those. We are going to look at the nose, which is down the side of the thumb. We're going to look at the sinuses, which is, we're going to work each of the fingers. We're going to look at the throat, which is this bottom part area here of the thumb. And then we're going to quickly work the chest. So a few to cover today. So as always, we are going to start with a little bit of oil or a little bit of moisturizer in the hand, along with a drop of tea tree, and then we're just going to rub that in and start with 3 deep breaths. And then we're going to start with the ears. So you can just kind of gently, so I'm just going to do it with my little finger to show, just kind of gently working all around kind of the base of that finger, covering it between 3 to 5 times. And then we're going to do the same on the next finger. So if you do, or your child does suffer of earache, then it might be a little bit tender around there, so just do it nice and gently. And the same on the left hand. Good. Onto the nose, so down the side of the thumb. So if you gently stroke down or up, doesn't matter which way direction it's going, you can do both. But really, if you do all of that area, then you will have covered the nose reflex. And the same on the left. So again, if you can do this between 3 and 5 times, really work that area. Then we're going to do the throat. So that's all the bottom part of the thumb area. So with this, again, you might want to use the whole of your finger and kind of working down or up. Doesn't matter which direction that you do that in. So ideally you want your hands placed on your lap, so you're in a nice comfortable position. And don't worry about the technique too much, it's just about stimulating that particular reflex. So again, covering that area 3 to 5 times. And then the sinuses. So the sinuses are all of the finger area. So with this, I'm going to start with a little finger. You kind of hold your fingers, and we're covering the sides of each of the finger. And you're going to slide them from the bottom to the top. And then we need to cover the front and the back. So I've held my hand in the same position, but I've just changed my fingers from there to that way. So sideways and then covering the top. And do that 3 times on each finger. If it is a bit tricky, you can just kind of squeeze up the sides and then kind of squeezing up the front and the back of the finger. This one does work a bit better when you've got plenty of cream on, so you can slide along the sinus area. If it does feel a little bit kind of crunchy or tender, and kind of work that a little bit more. And then the same on the left hand. So we're going, covering the fronts and the side of the finger. It's a bit of a trickier one to, to demonstrate, or you can just slide it up, as long as you're doing, covering the backs, all sides of the fingers really, you need to be covering for this one. I'm just pushing it up, and then the same on the back. You can do it both together, whatever feels most comfortable. And with this particularly, you might feel a little bit kind of crunchy, and then just work that a little bit extra. And then to finish, 3 deep breaths. If you do have any questions, then please do ask. If you want me to go through some of those techniques again, then please do get in contact and I can show you them again. Thank you, bye.